many of you in this group, because probably everybody's going to raise their hand, have ever thought, I'm going to do something spontaneously, you think you're going to do something, this is going to be so cool, and it turned out badly. I'm one of those. We've all done it. So a lot of times you have an inner voice inside of you that tells you that I shouldn't do this. I shouldn't get in the car with this guy because I know he's had a bunch to drink today at this party. I shouldn't get in the car with him. Don't get in the car with him. Your inner voice is right. When you start trying to talk yourself out of what your impulse is that you shouldn't do this, that's when you go wrong, and that's when you're more likely to get into trouble. So today, this gentleman here was riding a motorcycle. He had had a few beers at the local bar, and he crashed in the center of the freeway. He lost the lower part of his leg. He hit his chest, his head, his abdomen, and he's unconscious. The first thing that we do when somebody comes in that way is usually they come in and all their clothes are off already because the paramedics have stripped them, so they're naked, breathing. This guy was not breathing, so they ended up putting in a tube. And then somebody want to breathe for him? Anybody? Got it. And so in order to put this tube down their throat, we use pretty much this blade on most adults. There's a little light on the end here. It's not coming off. And I would hold this, put it down his throat, and see how far it goes. Lift up and look to see where his vocal cords are, and then I pass the tube down there. For you girls, a smaller one, this one, or maybe even this one. They have this one for a child, and they even have smaller ones for babies. They have a special kit for babies. Pass that around so you can take a look at it. And then, I don't know what happened in my tube. So we're going to work head to toe down this guy. We're breathing for him. Chest trauma. Ribs can break. It can cause a puncture to the heart, a puncture to the lung. If he had a punctured lung, we would only see one lung rise, chest rise on one side. So they put in a chest tube in order to take care of that. This is what a chest tube looks like. It goes in fairly far to this line here, so there's only a small part putting out, and the blunt end is what goes in. And the doctor makes an incision in their chest, and then they stick this in to whichever way the puncture is, and attach this to a little kit that's down on the side there, and every time that he gives it a breath, the air that's in the chest cavity now goes out so his lung can expand. That same type of incident happens a lot of times with young men who grow really tall. In a very short period of time, they'll feel like they're short of breath, and the doctor will take a chest x-ray and they'll see that they had a little, what they call a pneumothorax. And sometimes those repair themselves over a period of time. Other times they have to have a chest tube in order to repair that. When you puncture the heart, there's a little membrane around the heart. The blood will leak into that membrane, and that membrane, as it expands and expands, pushes pressure on the heart, and the heart can't beat. You'll look at the monitor and you'll see a normal heartbeat, but there will be no real heartbeat. The electrical activity is working, and the doctor puts a really long needle into the heart, about this long, puts it in, pulls out that blood, and then the heart can start to expand and contract again normally. And then we just have to watch and make sure all the time that we have a pulse, and that will heal itself up as well. There are different types of tubes that we put in. This is one of the other airways that prevents you from having any gastric contents from your stomach. If you vomited while this was going on, you don't want that to go in your lungs because it's acid. So this would prevent that. This tube that's in here now has a balloon that blows up. And we just feel this and make sure it's soft and not too hard, because you don't want it to be too tight. And then that does not allow any gastric contents to get down. So to prevent gastric contents from coming up in the first place, everybody gets an NG tube that's unconscious. And we measure that from their nose to their ear, down to their stomach, and then we put it in through your nose, goes down to your stomach, usually to this line or the last line, and then they hook it up to suction and suck everything out of your stomach. They do x-rays right away to make sure that there's no, pass that around, that there's no damage to your organs, because you have all these organs in here that can be damaged: your stomach, your kidneys, your liver, your spleen. Spleen injuries cause a lot of bleeding, and so they usually have to take you in and remove your spleen if it's really bad. They try to protect that spleen though if they can and keep it, and they'll take it out as the last option, but often they have to take out your spleen. Since he can't go to the bathroom on his own, you can see he's got a little tube that goes in, goes down to that bottle on the floor. This is what the tube looks like. They insert it in through the penis or in through the vagina, and then blow up this little balloon so it can't come out, because your bladder's like a balloon. It doesn't hurt. It might hurt going in, the lower part. For boys, it pretty much goes in all the way. You blow up that little balloon and it stays in there until the person wakes up and they can go to the bathroom on their own. For his severed limbs, that's something that they don't really worry about too often until after the fact. They wouldn't be just laying on the bed there. They would be wrapped in gauze and placed on ice to keep them cold, so they can try to put them back on if that's possible. Everyone also gets an IV, and there's several different IV catheters here. These are still in their containers. You can see what they look like. And this one here is actually the size that we like to use. Everyone usually gets 3 if they're in a trauma. So you can look at them. There's a metal piece that goes down the middle of each one so that they can be inserted more easily. If we're unable to insert them because the veins have collapsed or a lot of loss of blood, then the doctor will put one in the neck or in the chest area, central line. And that central line has 3 different tubes that come off of it that they can give medications through or draw blood through and prevent them from getting a lot of pokes. If I needed to suction him, I would use this little device to go into his mouth and suction, because now he can't swallow, so he's still going to make saliva. Any questions so far? So another thing that everyone asks about, you can give up on that if you want, and put somebody else on if they want, are overdoses. Overdoses is one of the worst ways to try to commit suicide. I want you to know it's extremely painful. People think, okay, well, I'm going to take these pills and I'm just going to go to sleep and it's going to be all over. Well, that's not usually what happens. Usually the medications go into your stomach and they cause severe pain. And so you're either trying to vomit or you're trying to poop to get it out. And it doesn't work because it's when you take a bunch of pills, they tend to band together and they form a baseball-sized clump in your stomach, and they can't go up and they can't go down, and they're stuck in there. So when somebody comes in and they do decide that they're going to pump their stomach, this is the tube that we use. It goes down through your mouth into your stomach. So it's probably going to go in this far on this guy here. And then we use these bags. This one's full of fluid. And we put the fluid into the person's stomach. One nurse takes charge of putting the fluid in and taking it out. By pulling on the one lever, the blue lever, it pulls the water out of the fluid bag and it goes into the stomach. And then you can clamp this off and pull out the waste. A lot of times, initially, you won't see any waste until somebody comes down here and starts pushing on their stomach, and they break up that baseball-sized clump to get it out. If it's an ingestion that has happened that they don't suspect one of these balls have occurred, then they usually, if you're awake and alert, they have you drink this charcoal. And charcoal is black like his sweatshirt, liquid. They put some sweetener in it to make it more easy for you to drink, but it's gritty. So you have to drink about a cup of that, maybe 2 cups. that goes into your stomach, and the sweetener that they use is sorbitol. It causes you to have diarrhea. So it's pretty gross. Your teeth get black, your lips get black, you have black on your face. It's hard to get it off your skin. I've had it on my hands for days. After even wearing gloves, I've gotten it on my hands and it's been there for days. You have black diarrhea, so your butt gets black, just like the charcoal. It's just not a pleasant experience to go through, besides the fact that overdosing is painful. Any questions? You guys are a quiet little group, big group. We can go out and take a peek at the crash cart. This is our crash cart here. It has all of the things that we would need for an emergency. They can be taken out to the parking lot if somebody who's really big, they couldn't lift up right away. We could hook them up and get all the equipment that we need and start an IV. These are the paddles that they use for when they have to start someone's heart.
What would happen if you did that to someone that wasn't having a bad heart?
If you did that to somebody who didn't have a bad heart, it could cause them to have their heart to stop. During a code, when we use these, so when we use these paddles, we don't use them very often. We use the hands off like the fireman probably showed you out there. But we do have these available if we should happen to need them for somebody. But the hands off are my favorite because I can see everybody who's around me. When the person's laying here on the bed, if you're leaning on the bed here and I shock that person, you're likely to get thrown back against the wall. It could stop your heart. Then we have two patients. So we always ask everybody to stay clear when we're getting ready to shock, and then we shock. On the count of 3, I'm going to shock, clear at the head, clear at the foot, clear on the side, and then you shock after you make sure everybody's clear. And with this, with the hands-free, all I have to do is look here and I can push the button. It was harder with these because I'm standing here and there's people behind me. And I have to turn and look at them, and then I might move my hands in the wrong position. So like I was saying initially, the main thing for you to take back from this today is that normally your first impulse about doing something wrong is right. Don't do it. Make other arrangements. Call your parents. If you need to have a ride home from an event, party, it's better if they do get angry at you than to end up being a victim of a traumatic incident where you end up with a brain injury. How many of you in this group know CPR?
I know CPR.
Well, it's really good to know, because when you're at an incident where somebody does have a cardiac arrest, you're able to do something. It's much worse not to know what to do and not to be able to get involved. Getting in there and helping gives you something to do, and you have a defined task, and so you just do your job and do the best that you can. There was a young lady who dove into a swimming pool here in Folsom. She had a heart problem, and when she dove in, she just sunk to the bottom. A doctor happened to be there. He saw her sink to the bottom. He got somebody to pull her out of the water. They pulled her out of the water and started CPR right away. It didn't look good for her though, because the paramedics arrived late because the address they were given was wrong. And they had to find the correct address once they arrived at the wrong address. So there was a delay. They got to the scene and they brought her to the hospital pretty quickly. Her parents weren't anywhere around. Someone had called her mom. Her mom came in after about an hour and a half of CPR going on here at the hospital. I think the doctor was just getting ready to say, this isn't going to work. We've given 3 rounds of drugs. Let's call this. And then her mother came and he says, okay, we'll try one more. So she came in and I said to her, come on up here and stand by the head of the bed, and I want you to talk to her and let her know that you're here. And so she started talking to her and talking about their plans for the weekend. And miraculously, all of a sudden, she had a heartbeat. And I thought, well, this has been so long, I'm sure she's probably brain dead. But she coded 2 more times after that and came right back. They got her in an ambulance and took her to a pediatric hospital. The next day she woke up and she recognized her family. The day after that they took the tube out. She didn't have any neurological deficit because the people who were there at that swimming pool knew how to do CPR. They did really good CPR and they saved her life and they saved her brain. So that was just really wonderful. She's doing well now. So we hear back every once in a while her progress. She got her driver's license. She was in high school, I think, at the time that it occurred. She got her driver's license after that. And she's off in college now, doing well. So think about it. Take CPR.